Shall we begin? Alright. So, in the previous class, we had the introduction of communication. In that, we discussed process of communication, different channels of communication, and what are the advantages and disadvantages of those channels of communication. We also briefly discussed what are the other aspects that are related to communication apart from language. Can anybody of you tell me that apart from language, what are the other aspects which are related to the process of communication? Yes, that is non-verbal communication. What else? Context, right? What do you understand by context? Yes, so around what topic the entire conversation is, revolves around, right? Apart from topic, the context is also about your linguistic context, your professional context. For example, the linguistic context of the sender and receiver should be same. If a student who is not competent in English language and that student is being taught in English language, will he be able to understand? Even after he is a very intelligent student, will he be able to understand if the linguistic context is not same? Will he be able to understand? No. So context is not just about the topic about which the entire conversation is all about, but the context is also about the language in which you are in which the communication is being taken place. The context is also about the culture. For example, if you give any cultural reference, right? Yes, please come in. What could be the cultural reference? What could be the cultural reference? Let's take a reference from a culture of Bihar, right? So, the people who hail from Bihar, they have this ritual of Chhath Puja every year. But for the person who don't have his roots in Bihar, if you are going to explain the entire process, will that person understand? Will that person understand what you are talking about? No, ma'am. Right? Why? Because the cultural context is not similar. In the same way, there is a professional context. So there are multiple things which you need to take care of in the process of communication, and that sender has to make sure that the information that is being conveyed should have a proper context, right? What is the other aspect, other element of the process of communication apart from language? Proximity. What do you understand by proximity? Closeness. The distance between the speaker and the receiver, or the sender and the receiver. That is not only the physical distance, but also the distance between the thoughts of the people, right? Again, the distance between thoughts comes under the category of context, right? The other is paralinguistic context element. What do you understand by paralinguistic element? Yes, voice modulation, tone, stress, right? All right. So all these are the entities that are being that should be focused upon in the process of communication. This is what we discussed in the previous class. We also discussed the process of communication, which includes sender, what else? Message, and encoding, channel, decoding, and receiver. What are the two entities that remain omnipresent in the entire process of communication? Context. Yes or no? And what is the last entity? Your feedback. What do you understand by effective communication? Yes, you were there in the last class, right? What do you understand by effective communication? No, please take your seat and answer. Okay, do you have any idea what are we discussing right now? All right. Yes, anybody, what do you understand by effective communication? Positive feedback. Very good. And if there is negative feedback? Yes, the communication is failed communication or non-effective communication. There is no word like ineffective. It's non-effective or failed communication. In today's class, we are going to discuss communication in healthcare, the strategies of communication in healthcare and the barriers of communication in healthcare. This is what our entire conversation is going to be about for today, right? Yes, communication in healthcare. So, there have been several studies that have been conducted in the field of healthcare which say that the poor communication has been the factor of around 1,700 patients' deaths, over $1.7 million in malpractice costs nationally in past 5 years. So, it is a study conducted by, what is the name of the organization? Here's healthcare. So, I mean, from this study, you get to know that what is the importance of communication in healthcare. Why it is important? Because there is a huge amount of patients who are dying because of the ineffective communication that is being taken place either between patient doctors or between doctors or between or even inside the hospital. It shows that the better communication methods would benefit both patients and healthcare providers, and that is why we are, having this class. All right, because the better communication is a dire need of the entire domain of healthcare. Effective communication both intra-hospital and inter-hospital. So these are two types of communication in healthcare which we are going to study in detail in further slides. Is important for healthcare providers to protect their patients, save on cost, and increase day-to-day operating efficiency. Meanwhile, patients benefit from increased access to their medical history, which reduce the chances of medical errors. So, the last line is a very important line. Why there is an introduction of, or there is an emphasis of communication in healthcare, so that the medical errors or the chances of medical errors come to an end, and this is one of the effective ways to reduce those medical errors. Because if any error that takes place in the domain of medicine, that is not caused by only one person. There are multiple people, who are involved in that entire process, and if there is an effective communication, the chances of those errors reduce. So this is why the importance of communication, in the entire domain of healthcare. One of the other factors that where the communication becomes important in healthcare is a focus on patient safety, right? क्योंकि जितने ज़्यादा medical errors होंगे, उतनी ही ज़्यादा patient की safety stake पे होगी. At the end of the day, who is at the receiving end? Receiving end पे कौन है? Patient. So, a focus on patient safety is the important aspect where there is a need of emphasis on the process of communication in healthcare. When considering the importance of communication in healthcare, patient safety is one of the top reasons to create an effective communication structure in any healthcare organization. Inadequate communication is often a leading cause of hospital deaths, and this is what we have discussed in the previous slides. Also, based on a survey or a research work. In a retrospective review of 14,000 in hospital deaths, communication errors is the lead of twice as frequent as error due to the inadequate clinical skill. What do you understand by this? कि जो communication की वजह से errors हुए हैं और उसकी वजह से deaths हुई हैं, वो double हैं. किससे? ऐसे deaths से जो क्लिनिकल स्किल्स की वजह से हुई हैं, कि डॉक्टर्स की जो गलतियां हैं उससे ज्यादा कैसे हुई हैं डेथ? इनइफेक्टिव कम्युनिकेशन स्किल्स. So there was I'm sharing a personal anecdote of mine where one of my acquaintance, he was operated on his left leg and he had his injury on his right leg. So what could be the reason? Poor, means one of the reasons could be poor communication, right? So these kind of blunders are, being seen in the entire fraternity of healthcare, and that is why a focus on communication has been given. While communication errors can have severe consequences, these issues are often relatively easy to fix, meaning many patient deaths caused by communication errors are preventable. That fact alone is one of the most important reasons why communication is so important for patient safety. Next is types of communication in healthcare. So there are two types of communication in healthcare. First is intra-hospital and the second is inter-hospital. Can anybody of you tell me what do you understand by these two terms? Very good. Inter-hospital. So inter-hospital communications involve, please don't talk. Inter-hospital communications involve information sharing among multiple sites or institutions. That is inter-hospital communication, means communication between two different hospitals, right? This includes transmissions between facilities owned by the same organization and between completely separate healthcare entities, moving patients from one facility to the another, sending medical records or transporting vital medical equipment, all require clear communication between the sides. So this entire process requires clear communication. Next is intra-hospital. Problems with communication also occur among personnel within the same hospital. Intra-hospital communication is any information sharing within a singular institution, whether it involves coordinating room changes, scheduling surgeries, assigning further tests, or even setting up the appointment. So these could be the steps where the requirement of intra-hospital communication is there. What are those steps? Scheduling surgeries, assigning further tests, or even setting up the appointments. When doctors, staff and patients are not effectively sharing information, the efficiency of each process may decrease, potentially resulting into unnecessary costs or even danger to the patient. Patient record delays, lack of procedural coordination, and even serious medical errors may all be consequences of poor intra-hospital communication. So these are the reasons where we need an effective communication within the hospital and outside the hospital. Next is transmitting patients' data. Now, transmitting patients' data is also an important step where we need a strengthened communication. Patient records are shared securely via inter and intra-hospital communications. Delays in receiving records can cost hospitals millions of dollars each year in unnecessary expenses. Patient data are used to create a thorough medical history and provide appropriate medical care. When patient data aren't shared between departments or other healthcare organizations, there may be much higher chance of practice errors and subsequent increased costs. The other important factor where we need a strengthened communication is collaborating between colleagues within the hospital. Intra-hospital communication relies heavily upon the collaboration between colleagues. Patients, lab technicians, doctors, and staff all need to be in constant communication to create a system that operates as smoothly as possible. Inter-colleague collaboration also includes entering information accurately into databases, especially shared ones. Inaccurate communication between departments can lead to errors in database entry, which in turn can potentially risk the patient's safety. So if any inadequate error comes in the database, it would lead to the risk to the patient's safety. Well, for an instance, if an incorrect diagnosis is entered in a patient's file, what could it be leading to? It would be leading to the improper medicine and further complications in patient's health. Hospital leadership. One of the another importance of communication is in hospital leadership. Whether publicly or privately funded hospitals are businesses and they need to operate as such. Hospital managers and other leaders must communicate frequently with doctors, staff and patients. All hospital leaders and managers not only oversee administrative staff and tasks, but can also play a vital role in an individual patient's healthcare plan. To be effective, they should maintain open lines of communication with those around them and also facilitate information sharing between hospital departments and with the other institutions. Next is telemedicine advancement. As you all know that there has been a huge emphasis on telemedicine at the present time when there was a surge in COVID cases. The emphasis on telemedicine was given to a certain extent. So the healthcare professionals are increasingly embracing telemedicine, which involves using a variety of internet-connected technologies to serve patients remotely. Their technological tools play essential roles in healthcare communications, according to American Telemedicine Association. Telemedicine goes even further by allowing patients to receive medical care and advice from the comfort of their own homes. Using the state-of-art communication tools, patients and healthcare providers are able to discuss health concerns via video chat, often eliminating the need for patients to visit the provider's office. Not only does this cut down the cost, but also the provider and the patient, but it also creates a seamless communication experience for everyone involved. But it is only possible when you have a good hold on the process of communication. So the introduction of telemedicine in healthcare has also come as a factor which strengthens the importance of communication in healthcare. Next so these were the factors why communication in healthcare is necessary. Now we are going to discuss what could be the barriers of communication in healthcare. What hinders the process of communication in healthcare? At the patient providers level, patients may not feel comfortable disclosing sensitive information such as the substance misuse or sexual dysfunction or their care providers. Patients withhold medical information for many reasons. So what could be the barrier between the what could be the barrier for the communication between patient and the doctor? The comfort level of the patient. How much patient is comfortable for sharing the information. So what should be done at your end? Your communication should be the way that your patient is comfortable sharing your information. So what are the reasons that patients are not able to communicate? They feel intimidated by their provider. They feel intimidated by their doctors. They feel scared of their doctors. Good morning. You need to go to washroom? और कोई सो रहा है? So, I mean, it is a good sign. Means you have studied well in your other classes, or you might not have slept in the night also. All right. So, what could be the reason your patient is scared of you? The patient might feel intimidated. The patient might feel scared. So, what should be done at your end? You should communicate in a way that your patient is not intimidated by you. They feel their provider won't listen to them. क्योंकि बहुत सारे लोगों की ऐसी body language होती है. Yes, they are working on themselves or working on their own, and they are not listening to the patient. So the patient gets to know if the person is listening to me or not. Your body language should be the way that your patient should be the patient should be feeling safe while communicating something, or you must be appearing like you are listening to them. Only then they'll be comfortably sharing their information with you. They feel disrespected by the request to disclose. They question medical advice. They question medical advice in general, because there are many patients who are not able to understand what you are advising. So you should be given proper justification for your prescription if the patient asks. Otherwise, what do doctors say? कि आपको क्या करना है? आपको नहीं मालूम है. But this is not the right way of answering, or at the end of the day, this is not the right way to make a patient comfortable. You should be answering all their queries. they struggle with physical and psychological trauma, because they are already, if any person is having any kind of physical issue, there is also a psychological trauma of that issue. So the patient is also suffering, and if you behave the same way, their suffering increase, which ultimately is not your motive. But we in oblivion do that. The other could be, what could be the other barrier? Language barrier. I mean, the reason for conducting these classes is to overcome one of such barriers, that is language barriers. Patients often have difficulty in communicating needs or symptoms when their provider does not speak in the language, or when the healthcare organization has not supplied an interpreter. Healthcare organizations that don't prioritize culturally competent care fall short in delivering inadequate support to the community. So what could be the what could be the strategy to overcome this? You must be attentive to the language of natives where you are serving, or if you are not, you must have an interpreter with you. The other is mismanaged healthcare files. Mismanaged healthcare files is also one of the barriers of communication which is there, because if your files are mismanaged, you won't be able to have the proper medical history of the patient, the proper diagnosis of the patient, and proper prescription of the patient. So if the patient comes to you for the second time, you won't be able to recognize why the patient has come, what is his problem, and what is the prescription that's being given to the patient. So this is also one of the barrier that comes to the process of communication, and when you are working, you should be able to overcome all these barriers. Next is strategies of effective communication. What could be the strategies of effective communication to overcome all these barriers? First, sit down and be humble. You should be humble to your patient. Ask open-ended questions. You should ask open-ended questions, because there are many patients who don't feel comfortable sharing their problem themselves, which could be related to the medical history, which could be related to their ongoing problem. They are not comfortable, they are shy sharing those issues. So you should ask questions so that they may answer them. You should ask the patient about their present situation, what's going on in their life. Ask the patient how they are emotionally relating to their health concern, or ask your patient about what they are worried about and what they foresee as obstacles, what troubles you most about the situation. And ask your patient about how they are dealing with their situation, how have they been handling this so far. You should be empathetic towards your patient. Show patient that you are listening, as I have discussed with you, that the major barrier to the communication is patients feel that their doctor is not listening to them. Reflect back what you hear them saying about their feelings that sounds frustrating, confusing, difficult, or satisfying. You should be open about them, and you should be, most importantly, not irritated by them. Next is a doctor must speak in plain language. So all of you are going to be trained for 5 years, and you will be retaining a lot of medical jargon with you, right? Your patient might not understand what stethoscope is, right? Or what HRV is, right? So you must be able to explain the patient in plain language rather than using medical jargon. Keep communication confidential. One of the important reasons why patients are not able to discuss their issues openly, because they feel that their information is not safe, or they feel that be judged by the doctor. But the communication should be confidential, and the doctor should be least judgmental about the patient. Hire interpreters and culturally competent staff at the entry level. So if there is any language barrier that is there in the process of communication, the doctors must have interpreters with them. All right. Attendance? So this is how we have completed the entire module of communication. From the next classes onwards, we will go on the language part. pre-assessment test. Yes, but I think the entire strength of the class has not joined yet. 50 students nahi hue abhi. Alright, so when they'll arrive, then we are going to have it. It is not any hardcore test which is going to take place. It will be just to check your linguistic competency. Alright, and in the wake of that, we are going to schedule our further classes. Where do you stand when it comes to language at present time, and how we are going to plan our further classes? This test will be conducted for that only. Alright, and this will be compulsory for everyone. It is also required for the record, for the college record also. That is why it is also compulsory. So even if any student miss that exam, the student has to come in the department and sit for that exam. Alright, it will be 10 mark exam. I am planning to conduct it this time on Google Forms. Hope that works out. So if it will be conducted on Google Forms, it will be accessible to everyone, even for the students who are not present in the class. Alright, so circulate 3 papers in all the rows and write your names, and please avoid proxies. Otherwise, it wastes my time as well as yours.